Hello, and welcome to today's LinkedIn Live session. I'm Will Mountford, and I'm delighted to introduce our guest today, Dr. Jehuda Soleman, a leading expert in clinical neurosurgery with a special focus on pediatric neurosurgery, neuroendoscopy, and patient-centered outcomes. Dr. Soleman is a practicing neurosurgeon at the University Hospital Basel and leads a research group at the Department of Clinical Research at the University of Basel. With a deep commitment to improving both surgical outcomes and the emotional well-being of their patients, Dr. Soleman brings a unique perspective to the operating room that blends precision, compassion, and innovation. Today, we'll talk about some of their journey, the challenges and rewards of working with young patients, and what their experience can teach us about resilience, collaboration, and professional purpose. So, Dr. Soleman, good morning and hello.
Hi, good morning.
Thank you very much again for joining with us. Just to give myself a bit of a background and for everyone listening, could you tell us a bit about your work, your profession, and what brought you to the position that you hold today?
Yes, thank you very much for having me here. So my name is Jehuda Soleman, as you said. I'm a pediatric neurosurgeon, but also a general neurosurgeon. But most of the time I do treat children with diseases of the brain and the spine here at the University Hospital of Basel. And I studied medicine also here in Basel, in Switzerland, and started my career in neurosurgery around 15 years ago. And actually, I went into neurosurgery kind of by accident. I did it as a student. I was fascinated. And that's how I got into neurosurgery. And I always wanted to do something with pediatric patients. Since I was young, found pediatric patients very fascinating. And I wanted to combine it with neurosurgery. And that's how, in the end, I ended up doing pediatric neurosurgery, which is really a fascinating thing to do, in my opinion.
If I might ask, do you have children of your own?
Yes, I have two kids. I have an 11-year-old and a 3-year-old. Yeah.
And when it comes to treating children, do you find that there is anything that hits especially close to home that you see in your own kids and you see in other children that kind of motivates you to deliver above and beyond a level of care?
So I think there's the obvious things about treating children. They have their whole future ahead of them, and if you can help them, which we often do, that's something that's very rewarding. Of course, if you have your own children, it's also kind of a challenge, because every symptom, every sign, every cough, every sneeze, you kind of think maybe it could be something, because of course, more than other people do. But it's something that you get used to and you have to cope with. I think, like anybody else has to cope with different things that they come across when they have children. But of course, to see my children grow and to see my children develop is something that gives me also motivation to help others, which are maybe not so fortunate to have healthy children, to help them also get to this phase, maybe even defeat the disease, so that their children can grow and be healthy and be happy and have a good future.
Yes, I've got two very coughy and sneezy children at home at the moment, so you have my sympathies for all of those symptoms and for everything beyond that. When it comes to those common conditions, common neurological conditions, at least in children, what are some of the things that you see most often in your practice?
So as a pediatric neurosurgeon, what we often see is weird, I would say, different shapes of the head. So there are some diseases where the sutures, we call it, that's the opening of the skull, which close too early. It's called the craniosynostosis. So that's something that's quite frequent. And then you have to decide, is it really something that is a problem with the sutures of the head, or is it just the positioning? Often, as most of the people know who have kids, if you place your kids on the back head, then the back head might get flat. That is not a disease. That's just a condition that you have to treat with positioning. But then there are diseases where the sutures close, and that is something that can be a problem with brain development. So that's one part of our practice. The other part is hydrocephalus. It's when the fluid within the brain, when you have too full or too much, or you have excessive fluid in the brain, that it's something that can cause pressure in the brain and also be very dangerous. Also, especially in babies, they can develop, and it ruins their brain if there's too much fluid, and that is something that we need to treat. Another special part is tumors, pediatric brain tumors, which are very different from adult brain tumors. And that is also a specialty that we need to be very much meticulous about, because also we sometimes operate on very small children, very small babies, where the blood volume is also very low. So that's something we need to really take care of. You need to be fast, so the blood loss won't be too much, but you need to be very meticulous so that you get out all the tumor, because that is something that is very, very important for the prognosis of the disease. And then we have some spine conditions that we treat. It's called tethered cord, or the whole spina bifida. That's something I think that is also known for people who don't do medicine. That's the open backs, children which are born with the defect of the spinal cord.
Okay. And when it comes to being in that surgery room, you mentioned the need to move fast and to kind of be as precise and efficient as possible. Who else is in that operating room with you, making that work?
So I think that's a very, very important point. Doing surgery on pediatric patients is really a teamwork and a team effort. It's not only the pediatric neurosurgeon who, of course, needs to know to navigate around the brain, know the anatomy, know the diseases, and know also when to stop the surgery because it becomes too dangerous, because in the brain there are regions where we cannot operate on, and we don't want to cause defects of the brain, which then are not good for the quality of life of the kids. But we need also a very good anesthesiologist team, which manage all the monitoring of the patient, where they need to know when the blood loss is too high and they need to start giving blood, especially in very small babies. We sometimes operate on babies who are 2.5, 3 kilos, meaning they have a blood volume of maybe 250, 300 milliliters. So if you lose 50 milliliters blood, it's a lot of blood, and these kids can go into cardiac arrest. So that is something that we need. And of course, we need the scrub nurses. Sometimes we have a neurologist with us in the OR who monitors the kids, the function of the kids. We can monitor the function during surgery, and all these subspecialties have to work together very harmoniously, so we can perform the surgery as fast as possible, but as efficient as possible.
Mm-hmm. How do you foster that kind of collaboration? Is it just kind of being in a high pressure environment, everyone at their best, or is there, a teamwork in a sense of teamship outside of the OR?
So I think for sure what's very important, and that is something that we see more often in children's hospital, is you get to know the teams beforehand. Often we see also the patients together with an anesthesiologist, with a neurologist if needed. And of course, it's also a matter of being and working together on a daily basis and getting to know each other also outside of the operation room. I think that is something that is very important for the harmony within the operation room. But still, there's always there are some things that we do so that the surgery works better. So we have checklists before surgery, which we go through everyone together, so to see that the patient safety is given. But also during surgery, everybody knows that short commands, listening to one another, not too much noise in the operating room. Those are like basic rules that apply in the during surgery that help us achieve those goals.
Mm-hmm. Well, that sounds like everything ideally going well, people working together. When the stakes are high and decisions are critical, if anything does start to go kind of not according to plan, how do you work together, and does anyone need to take charge or be in command in that very kind of that tight window when decisions are so very vital?
So if we're talking about during surgery, there are some critical moments during surgery. There are also critical moments before going to surgery. So that's two different things. So during surgery, of course, the surgeon is the one that is in charge, because he's the one who knows the parents, he's the one who knows the patients, and he's the one in charge of the patient at that moment. But that doesn't mean that he's the one who knows everything. So the control and to be in charge is the surgeon, but it's very, very much a lot of communication also with an anesthesiologist. It's like having a pilot and a co-pilot. You need both. And if the communication is not good, or if one of them loses the guard, then it might get critical. So we are very much dependent also on the anesthesiologists. I am very much dependent on the scrub nurse, that, if I need something fast, if I need the instruments fast, she's there or he's there. And the same goes for anesthesiology. But at the end of the day, if something goes wrong, we are the ones who have to go to the parents and communicate with the parents. And unfortunately, it could happen. It can happen that something goes wrong. But I would say in most of the cases, if you have a good team, then you can avoid these things from going wrong. And a lot of times you can even fix it during surgery.
Mm-hmm. Yes, if only everything kind of was within predictions and you could always expect what happened next. When it comes to working with young patients on the operating table, but also, as you say, outside of the operating table with their families through all of their care, are there any ethical considerations that are at the forefront of your mind besides just, as you say, giving the most potential for life gained after surgery?
Yes, and the ethical considerations in children are, of course, much more difficult because the decision making is different than in adults. Children, as I said, they have their whole life in front of them, and if you need to take decisions which are on a matter of life and death, it has much more consequences for the time frame you are influencing. And of course, if an 80-year-old, an 85-year-old has a let's say a trauma, where we say, okay, he lived his life, probably the quality of life will not be very good, so we end the treatment. In children, that is much more complex because you have also the parents, and you have a lot of emotions, and also the teams get emotional. That's natural if you have a small kid who has suffered a head trauma. It's much more difficult, and you need a lot of more communication and discussion within the team. And we also have ethical boards. Sometimes in the emergent situation, you can't really go and consult the ethical board, but if there's some time, you can bring in people, also people who are not involved in the case, and they help you make these difficult decisions. Let's say oncological patients which have been suffering and where that the tumor is not treatable, then we always try to do it within ethical boards, but it's always very difficult decisions. But I have to say, this is a very important point. This is something that is not very often in children, because children potentially, or even in the brain, have much more ability to recover. And the brain functions are different than in adults because they are still developing. So functions that they lost because of a trauma or because of even a complication during surgery, they can much easier gain again than we adults can do, because the brain is still developing and they can build new networks. So that is also an ethical aspect, that we know that a child that maybe doesn't speak after trauma will much rather speak than an 80-year-old who doesn't speak after trauma. And those also these decisions, this also influences our decision making, because we know that the potential of them recovering is much higher. So it's very, very complex. And I think that is something that if it's not time pressuring, if it's time pressuring, we just have to decide, and we decide with the parents and we talk openly with the parents. But if it's not time pressuring, then we can do it within ethical boards, bring in other people and consult in a team. And then it's more a team decision and not one person's decision.
Mm-hmm. Now, to pick up on the mention of oncology there, something that has been of tremendous interest in oncology over the last decade or so has been the push for personalized therapy. I can't think of any situation where care has to be more personalized than with a child on an operating table in front of you. Is there something that oncologists or other medical professionals could learn from pediatric neuroscience in terms of being, tailored to that one person in front of them? Or is there anything that you think could be brought from other learnings into pediatric neuroscience?
So I think, the oncologists, they know very much what personalized medicine is nowadays, and especially in brain tumors, also in brain tumor surgery, but also brain tumor oncological treatment. There was in the last couple of years, there was like kind of a breakthrough in some kind of tumors where we really have medications which are based on the genetics of the tumors. And that is something that, for example, which is a difference to the adult tumors. It came from the adult tumors, but not from the adult brain tumors. But in the pediatric brain tumors nowadays, we know that we have targeted therapy, we call it, which is like personalized therapy for an individual tumor. The same tumor name could be different in two different patients, and we can focus the medicine that we give to the specific genetics of that tumor. But also in surgery, for us, it is very important. We always send in a sample to the pathologists during surgery, and they give us the first feedback, what they think it is. And for us, it is very important to know what kind of tumor. Is it an aggressive tumor or less aggressive tumor? Because then we tailor our surgery also based on that information. We always try to get everything out because we know that the prognosis, if we take the whole tumor out, is much better for the child, independently of the type of tumor. The problem is that in the brain, you can't always take everything else out because you might ruin functions of the kid, and that you don't want. But still, if we know that it's a type of tumor where no chemotherapy or no radiation is going to help, then we might even be very aggressive, take into account functional problems after surgery with the knowledge that patients can recover. And I have seen that by myself. Patients who weren't able to swallow, patients who weren't able to breathe, where we were very aggressive with the tumor, but we were able to heal them. So I think it's a combination of oncology and neurosurgery, especially in brain tumors, where we need to know how aggressive we have to be or need to be, and what are the options afterwards that oncology has for some specific tumors where we don't have to be that aggressive because they can give focused treatment for those tumors. And that is something that is very unique to neurosurgery, which only exists in pediatric neurosurgery at the moment. We hope that it also will exist in adults.
Well, for non-medical professionals, anyone, not just for patients and patients' families, but for people in orbit around that care and also in orbit around your profession, is there anything that you would like for them to be either more aware of or learn from pediatric neurosurgery? It could be the specificity, it could be the ethical considerations, or it could be that teamwork that we mentioned earlier from the OR team.
So I think something that fascinates me always in surgery, but also in medicine, is the patients come very sick. The parents are very devastated, and one of our jobs is to give them hope. And I think that is also something that we can project to many other subjects in life. That if you have a good team surrounding you, it might be even a family or colleagues. And if you think positively, and a lot of the healing that is done in pediatric neurosurgery is the parents, if we manage to, we tell them the whole truth. We tell them also the bad things, but we tell them also the good things, what might be and what might happen, and how their kids are resilient. And kids are resilient. They're much stronger than us adults. And kids want to play, and kids want to heal. They don't feel sick. They feel healthy. And that's why they recover also very much. So a lot of our job is to make, in the whole bad situation, something good out of it, and tell them we have a chance for healing. We have a chance to help your kid. Maybe it will be a very long way and a lot of hurdles on the way, but at the end of the day, we will guide you there. And at the end of the day, we have hope. And that is something that I think, especially in these times we are living now, that if you have teamwork, if you have people harmonizing, and we have people from all over, different cultures, different people, but if you work together, you can achieve a lot of very good things. And that is something that I see on a daily basis, and I think that is something that we can project also to the world and to almost any proficiency.
Mm-hmm. Sounds like giving care is more than just giving medicine.
That is true. I mean, it's also being, I always tell the patients, if I wasn't a positive person, I wouldn't become a pediatric neurosurgeon. And I think that's true for a lot of medical things, because this is it's a profession that we see a lot of suffering, but it's a profession also that we see a lot of healing, so we can give hope.
Is that something that keeps you inspired and motivated? And what else might keep you kind of on that optimistic track?
So yes, luckily I have to say a lot of patients that we treat do get better, and we can really help them. And we follow our kids up to adulthood, and I have also an adult clinic where I see my pediatric patients, and now I'm old enough to already have seen kids that I've treated that are now adults. So that is something that really gives me motivation. Of course, on the way, we have patients that do suffer and even die, and that is very, very, every patient that dies is something that really is very saddening, of course, and every doctor has the patients that he keeps in mind that died, but the most of the patients are an inspiration, and also the parents. Parents who have sick kids, it's an inspiration how they fight and how they go through these treatments. That is something that really gives me motivation for the next patient, and I think that's what keeps any pediatric neurosurgeon, but also any doctor going. And that is also something that I think is very, very nice in pediatric neurosurgery. The patients, they have very serious diseases, but they also recover very well because they are kids. And that is something that is very special in the pediatric population.
And if there is anything that a doctor in training, or maybe an aspiring neurosurgeon, was watching this and wanted to give them kind of a little bit of motivation or advice, is there anything that you would say to them before they kind of commit fully to this incredibly demanding yet rewarding field?
So from my experience, and that is something that I was thinking about a lot during my studies and afterwards, before I started neurosurgery, I think you have to be committed. If you're not 100% committed, then it's difficult, because it is demanding, and it's a long way, and you have to train a lot. You have to be also very critical with yourself often. And if you're standing alone, if you don't have a family, then it's just you and yourself and your decisions and how much you want to put into it, and you will have to put into it 100, maybe 150%, I would say. And of course, for those young people who will have a family and will have kids, you always need the support of your family. And that is something that, often we don't think about. As young surgeons, we're motivated and we say we want to do surgeries, and it's fascinating and it's interesting and it's motivating. But of course, you have a family, and when you get older, the family becomes more dependent on you. And that is something also that, if I could give an advice, you need to be prepared for, and you need to prepare also your partner or your partner in, the female or male partner, it doesn't matter. Need to prepare them for what's going to come, because it is a lot of investment. You need to invest a lot of time to really be a good and devoted pediatric neurosurgeon. But it's very rewarding, so I wouldn't do anything else, I think. Yeah.
Right. Well, that's bringing us just about to the end of our time. So Dr. Soleman, thank you so much for talking us through everything in your field, and fingers crossed that you still feel all of that rewarding satisfaction for many years to come.
Thank you. Thank you for having me. It was a pleasure.
And everyone watching at home, make sure you stay tuned for the next LinkedIn Live session from Karga Publishers. We'll see you there and then. But until then, I've been Will Manford. Thank you again, Dr. Soleman, and we'll see you all again soon. Goodbye.
Bye-bye.